Okay, so today I'm going to be talking about wound packing, and this is going to be another sterile dressing for you. I guess the last one you did was N151. So you may have to review some of those principles of sterile technique again, especially if you haven't had an opportunity in clinical to do anything sterile. We're going to be watching your sterile technique. Remember, you can't turn your back on your sterile field. You can't reach over any of your open supplies. You may have to review putting on sterile gloves again, where to pick up the first and second one. And then also when you have your sterile gloves on, not going to be putting them down below your waist. Everything should be waist level. Okay? So just a couple things to remember when you are packing a wound. You're trying to lightly fill up that space. Okay? So the edges of the wound should all be in contact with the gauze. You're trying to make the gauze kind of light and fluffy and pack it in there, fill up the space so you don't have any dead space, which may create an abscess. Okay? So you're just kind of lightly packing it in there, and you should be bringing it up level to the surface. You don't want the edges going out of the gauze to go out over the edges of your wound, because then it's going to cause the skin breakdown. Okay? So just bring it right up level. All right? And probably with some of the wound vacs you're seeing now in clinical, they are taking place, a lot of the wound packing dressings, so you may be seeing this even less. As far as the drains, I'll just go over those quickly. This would be your Jackson Pratt drain or your JP drain. To empty any of these, obviously you would have gloves on. This part would be going into the wound itself. This would be the part that's exposed. And when you pop this top off, just make sure you have it pointed away from you, because a lot of times they will spurt. And then you're emptying it into just maybe a specimen cup for your I&O. And then the big thing with these JPs are you need to recompress them when you put the lid on, and that's what's going to be creating that suction and drawing the drainage out of the wound. Okay, so that's the JP. This one is the Hemovac. Again, this would be into your wound, or if you have an incision. Again, with these, pops off, and with gloves on, you're emptying that into your specimen container to get your output. And then again with these, you have to, it's kind of like an accordion, have to compress this before you put your top on. And again, that's what creates the suction and pulls the drainage out of your wound bed. Another type of drain you may see is a Penrose drain. Okay, and you're just going to see, you'll just see this coming out of your, probably an incision. Okay, and then this will just be collecting onto your dressing. So that's the Penrose drain. Okay. When you do this validation, any kind of dressing supplies you have in your kit, bring in. You should have ABD 4x4s. This will be the last dressing change. So anything you have, bring in. Otherwise, we'll have supplies here. And I do have a cart loaded for you there. So first thing you would do would be to check your doctor's order, okay? When we're doing a wet to dry wound packing, okay? So come into the room. I'm going to wash my hands, identify my patient, let them know that I'm going to be doing a sterile dressing procedure. The other thing with this is it may be painful, especially since I'm going to be packing into a wound. So you may want to offer some pain medication and then come back in about 30 minutes to do your dressing change. Okay? So I'm going to go ahead and just put on some clean gloves. have the bed up to a working position. Just going to drape my patient for privacy. And he would probably be laying more flat. I have him propped up just so you can see what I'm doing. Going to loosen the dressing and pull it up. Looking at my ABD for the drainage, color, odor, consistency, amount, and that's just going into my biohazard. Same with my 4x4, noting any drainage on there. And I have a sterile suture removal kit here. And I'm going to use the tweezers in there to just take out the packing. And when I take this packing out, I'm going to note again drainage. I'm going to notice how much I'm removing so that when I repack it, I know how much to put in. And the other thing I'm going to pull out is a packing strip, and that was in one of the tunnels. Okay, so I'm going to go ahead and get rid of that. And I'll get rid of this. Okay, so right now you're just going to do an assessment of the wound bed, noting the tissue in the wound bed. Again, looking at the surrounding skin, any drainage. I'm going to be doing some measurements. With this particular wound, there's undermining, and there's also, there's actually 2 tunnels. We're just going to be packing one of them. So to measure the wound, with the undermining, you can kind of treat it like a clock, okay? So 12 o'clock would be up towards the patient's head. And at this point, I just have my clean gloves on, and I'm just keeping the tip of my Q-tip sterile. So 12 o'clock, I would just kind of note where that is, and then compare it on my measuring here in centimeters, okay? I would get a new Q-tip for a different area, and again, just kind of keep acting like this is a clock. So 3 o'clock, I would note the measurement on there, get a new Q-tip for a different area. 6 o'clock, toss that, new Q-tip, and 9 o'clock, and that covers all the undermining, okay? If I wanted to measure the depth, same thing. I'm just going to get an idea how deep the wound bed is. Okay. And the other thing you can measure, again, we're just going to be concentrating on one tunnel, but with another Q-tip, I'm just getting an idea what that tunnel is, and then noting all those measurements in my documentation. Okay. Can also do length and width. Okay? All right. So now that I've done my assessment, I'm going to go ahead, take off these gloves, and wash my hands. And I'm going to get set up for my sterile procedure. You can do this one of 2 ways. To me, it's a little bit easier to do it like this because then I can kind of free some space up on my table because there's a lot of different supplies here. So I'm going to go ahead and open, this is just your tub of 4x4s. And again, you're trying to be conscious of not reaching over. Go ahead and open that. Then I have packing strip here that I'm going to be packing into the tunnel. And I have a new sterile suture removal kit here that I'm going to use to cut the packing. And keep in mind, if you're right-handed, your scissors should be in your right hand. Otherwise, you're going to have difficulty cutting this. I'm going to go ahead and pull the packing out. And I'm just kind of estimating how much I need. If you can kind of cut down into this, that way you won't have a piece that flops out over the edge and gets contaminated. I'm going to add that to my tub of 4x4s. That way I can go ahead and get this off my table, and go ahead and get rid of the packing strips off the table. The other thing I have here is my saline, which I'm going to use to moisten it to do my wet to dry packing. If I'm the one opening this, I'm going to initial date and time, and then remember this needs to be used within 24 hours. I'm going to go ahead and just moisten the packing strip and my 4x4s. And then again, I can set that aside and get that off my table. Okay? So now that that's done, I'm going to open up the rest of my supplies. And I have 2 new Q-tips here, and I'm going to use this to pack in the packing strip into the tunnel, and then also the 4x4s under the undermining. And I just want to make sure I'm not touching the wood, because the wood I'm going to be handling with my sterile gloves. And I'm going to put these back here out of the way so that I'm not reaching over those at all. Okay. And you go ahead and tear some tape. And then open up a 4x4. And remember, you're not opening like this, right? Okay, you're not reaching over. If these rip at all when you're doing it into that 1-inch border, just let us know that you would need to replace it. Okay. So again, before I put on my sterile gloves, I'm going to make sure I have everything else open, because the only thing I can touch with my sterile gloves would be my sterile supplies. And make sure you're opening this glove paper so that it stays open and you're not fighting with it the whole time, flopping back and forth. Sometimes if you put a little crease, it helps. Okay, so first glove I'm picking up like this. Make sure you step away so that the fingers aren't getting contaminated. And pull that on. The second one, and remember you can hold this glove paper to keep it spinning, because you don't want it spinning and contaminating your supplies. Okay, so your second glove, like this, keeping that thumb away. Okay, and now I'm keeping these above my waist. First thing I want to do is put the packing strip into my tunnel. So sterile can touch sterile. I'm going to take a Q-tip. Sometimes it helps if you moisten it a little bit. And I'm going to be packing like this so that my hands aren't getting contaminated on the surrounding skin. So I'm just guiding this into my tunnel with my Q-tip. And the goal is to not contaminate it on the way in. So this is the part that takes a little practice. And I'm leaving a little bit of a tail so that the next person can remove that packing strip. That Q-tip gets tossed. I'm going to reach in here. Remember, you're not reaching like this. Reaching so I'm not over my other open sterile supplies. Wring it out because you don't want it dripping wet. And then I want to unfold this as much as I can because, again, I'm trying to pack it in there fluffy and not too tight. And so just open it as much as you can. It helps if you then fan fold it so that you're kind of protecting it in this hand as you feed it in under the undermining with this hand. So I'm going to grab my other Q-tip, moisten it. And this is the part where if he were flat it'd be a little bit easier, but then you're just, again, you have to kind of keep your hands like this because I don't want to be letting my sterile gloves touch the patient's surrounding skin. So I'm just feeding this underneath the undermining. Again, you're just loosely filling up all that space. You don't want any space that doesn't have any packing in it. And the part in my hand, I'm just kind of protecting so that it doesn't get contaminated on the way in. If this touches the surrounding skin, just let us know. This is the part where if it were a real wound, I think it may stick in there a little bit better. Okay, so then again, just trying to bring it up level with the surface of the skin and trying not to let it overlap the surrounding skin so it doesn't cause breakdown. And I'm going to pick up my 4x4, place that on top, pick up my ABD, place that on top, and then at this point your sterile procedure's over. I'm just going to leave my gloves on until I get it taped. Okay. I could initial date and time one of these pieces of tape so that the next person knows when the dressing was changed. Okay. So at this point, just make sure your patient's comfortable. Going to clean everything up, lower the bed, raise the side rails. The things you would want to document in your nurse's note would be the fact that you did a sterile, wet to dry wound packing, and then your wound assessment, your measurements you took, the appearance of the wound, any drainage you noted, if you medicated the patient prior to the procedure, and how your patient tolerated the procedure. Any questions at all? Anything else you want to add, or?
Maybe just describe to them how you would irrigate it if you had to irrigate it, or if they had to take a culture, when to do that.
To irrigate, you would have an irrigation set here, or I guess a lot of times you guys just use the pre-filled normal saline syringes. Again, it's supposed to be a sterile procedure. You would need a doctor's order, okay? It needs to be a sterile procedure in that you really wouldn't need sterile gloves. You just need to keep the tip of that syringe sterile. You would just be holding it slightly above the wound bed to irrigate, okay? You would also need some kind of a receptacle, like a basin or something. And then typically, you're just holding it above, keeping the tip sterile, and you would be irrigating until your irrigant runs clear. Okay, you're trying to get all the debris and everything out of the wound bed. Okay. And then for a wound culture, again, you would need a doctor's order to get a sample of the wound culture. And that's just like the one that I have sitting out for your specimen. I think you're supposed to take from several different areas. There's 2 Q-tips in there, okay? So you're taken from several areas of the wound, and then it goes back into the vial there to go down for a culture. Okay.